several occasions we have repeated that the epidemic is far from being controlled, and I think today, unfortunately, we are very far from controlling it.
This most deadly Ebola outbreak has so far affected 4 countries in West Africa: Guinea, Sierra Leone, Liberia and now Nigeria. The death rate from the current outbreak is estimated at 50 to 60%. Almost 900 people have died. The Ebola outbreak has even intruded on a US-Africa summit this week in Washington.
And let me welcome the delegations from Sierra Leone, Liberia and Guinea, with whom we are working so urgently to control the Ebola outbreak and whose citizens are in our thoughts and prayers.
I don't know anything about Ebola, only know Ebola, as I know, is just some kind of zombie symptoms like the Walking Dead itself. So that's all I know actually.
Very sure, but I know it's a disease and a virus. It's not under control.
Okay.
So I feel the virus is very strong.
Ebola is actually, I know it spreads by bodily fluid, and whoever infected very badly and they were very sick with Ebola, they will actually transmit the disease via saliva.
Ebola is known as a deadly disease caused by virus.
Okay, I understand about Ebola.
Okay.
So based on my understanding that Ebola is a very dangerous virus, started somewhere, identified back in 1970 something, but then there's been a lot of outbreaks in Africa. So this thing actually started, you can get it transmitted by bodily fluids and so on, blood and so on.
Ebola is a fever caused virus, and then there are a few types of virus. It can be from Ebola virus, which is named Mabura, Kauso, and it's another 3 types of viruses. But basically, a patient who have Ebola virus is come with severe fever, vomiting, diarrhea, and so on. So it was all the while the patient who have Ebola virus is associated with a severe fever, which is fatal.
We understand the word Ebola. It's a virus.
Ebola is a virus. It's a virus that spread through different ways of contact.
No. Heard it's from US, I guess.
I see the news is come from US and
Not really in Malaysia.
Okay, this Ebola virus is mainly from the African countries.
Outbreaks in Africa.
Ebola is originated from Africa. This belief that the wild animals has passed on to the human, where the patient has been eating the wild animals, and then basically the virus is from the organs and the liver and parts of the animals which is eaten by the human being. But lately it was found that this Ebola virus can transmit human to human, which is very serious, and it has been caused an outbreak in Africa.
Very normal kind of symptoms like headache, fever and so on, the primary stage, and moving on to the second stage like rashes and so on. And of course, to the dangerous part where you start to bleed from your gums and so on. So this bleeding could actually lead to your death in the first place, because of your low blood pressure and so on.
Yeah.
The transmission, like I said, is from through bodily fluids. But then, of course, initially it started as these bats, animals. So these bats, somehow they're immune to it. So when they transfer it to the humans, right, when humans eat or in contact with them, so it transfers to human body. So if you're having sexual intercourse or, you are having a bodily fluid touch like blood to blood and so on, or even you touch a place where it has been touched by an Ebola patient, you could get it as well.
Infected by Ebola, but I don't know what's the cause and what it really do to people until I go study about it on the internet. WHO. It starts very simply by having fever, diarrhea,
the basic symptoms, but then the consequences is really, really bad.
The scientists have been working very hard to find what is the solution for Ebola. Since the Ebola viruses is 3 to 5 types, it is hard for time being to find the solution. So the scientists has been taken samples from the patients to develop the vaccine, and it is not so easy as what we think. The scientists are working very hard to develop the vaccine for Ebola.
And to prevent this, they are trying to quarantine the victims. But the problem is Africa is really populated with a lot of people, and then their healthcare there is very, very poor, which now the Americans have to set up places for them and also to help them. So it can be very dangerous if we come to Malaysia, although we can say that it's still far away, but then who knows, anything can happen. I can go to Africa and then I got infected, I come back without knowing, because it takes until 21 days to actually know the symptom that's actually Ebola. So yeah.
Okay, as a safety precaution, health workers, especially handling the patients of the Ebola, must be very hygienic, and then the burial services of the patients where the viruses can transmit it to the human being must be conducted in a very proper manner, and then doctors, health workers and co-workers, laboratory workers who are involved in Ebola researchers must be follow very strictly the precaution method of research. Precaution to prevent this Ebola: try to avoid contact with animals, especially wildlife animals, and then do not eat organs or wild animals' organs which is contaminated with Ebola virus. Then if you found that you have a fever and then you are just coming out from the country which is happen to be an Ebola epidemic in that country, particularly in West Africa, Sierra Leone, Nigeria, Uganda, such countries that which is highly noted for the Ebola cases, immediately you should refer to a doctor for precaution methods. Other than that, health workers should know how to conduct a proper manner of handling patients who with the Ebola virus.
Well, we hope that doctors, come up with a vaccine for it. That's all. Just be careful and get educated yourself.
I think awareness in Malaysia about Malaysians about Ebola is very, very low. So we should educate the public more about the danger of Ebola. If it comes to Malaysia, it will be too late already. So to understand that and to take this issue seriously, people need to get educated. Okay, not just people like you and I, but also children. Perhaps they need to know what's going on. Although it's a very adult thing to know what's this one.